Now we see there will be a surge in traveling in Spring Festival in Zhejiang too. So Dr. Wang, I think, do you think your hospital will face more pressure in terms of medical resources scars during the Spring Festival travel rush? And do you think your hospital can handle that wave?
Yes, I think there will be a massive mobilization in our country during the holiday. So according to some data models, the infection peak in China may arrive another peak, around the festival will arrive to another peak. So as for our hospital, I think we have a very good running system to face the possible surge of COVID-19. So we are so confident to cope with it. And there are several measures we already get ready. First, we focus on speeding up the patient flow of our emergency room. For example, we are the first hospital in Zhejiang province to open up a very special clinic we call the general respiratory clinic. So to increase our service capacity, so we the clinic will be open from the 8 a.m. to 12 a.m. in the middle night. So we also have more consultation doctors sitting in the clinic. So the purpose of the clinic, of this very special clinic, is to relieve the pressure in the emergency room. As you know, many people they came to ER in the midnight may not be so critical. So we for these kind of patients, so we can advise them to go to the respiratory general clinic. So we try to make sure the limited resources for those patients who are in real critical situation. So second, we build up we call the makeshift beds for intensive care and respiratory medicine. So now used to we have around 200 ICU beds, but now we extended the number of ICU beds to the 600. So we also established a very specific unit we call the step down units. So which have 200 beds. So the step down beds work as a buffer to provide an intermediate level of care between intensive care units and the regular general unit. So we also the hospital administration make sure all hospital beds are under the same stratified management in the whole hospital. Third, we build a staff pipeline. We made great efforts to allocate human resources to support the frontline departments, such as respiratory medicine, emergency room, intensive care units, and step-down units. We encourage multidisciplinary discussions for high critical patients. So we standardize the clinical pathway for COVID-19 treatment. So we would like to ensure our patients' care keep consistent across the different areas over the whole hospital. So as possible as we can. So we even ask our hospital leaders, the president and the vice president, to take a call overnight at the hospital. So they could help facilitate strategy implementation, and it's very good for a response approach. So make a necessary adjustment in a specific situation. We also encourage patients to make only essential in-person visit to our hospital. So some patients, they have mild symptoms of COVID-19. They can stay at home and treat themselves. So some patients, they need to, they just need to refill their prescription for their chronic illness, so they can get the prescription online. You know, we updated our online consultation services. So the service now is 24 hours a day, 7 days a week. And so the insurance cover the reimbursement. So the prescription could be delivered to the patient's site. So more importantly, bedside equipment facilitation is very important. So such as the ventilator and the ECMO. So we keep emphasizing medical efficiency. For example, we have optimized and updated admission and discharge criteria for ICU and the general ward. So we try to make sure the limited medical resources are running more efficiently.